Everyone, I'm Dr. Renee Mehrra. Thank you for joining Zooming with Renee. Today, my guest is Dr. Ravi Kolli. He's the current president of AAPI, which is the American Association of Physicians of Indian Origin, one of the largest ethnic medical organizations in the United States. Dr. Kolli is a board-certified psychiatrist and serves as a psychiatric medical director for SDS, which stands for Southwestern Pennsylvania Human Services, and he has special qualifications in addiction as well as in forensic and geriatric psychiatry. Thank you so much, Dr. Kolli, for joining us today on Zoom with Renee.
Thank you, Renee, Dr. Mehrra, for inviting me. It's a pleasure and an honor to talk to you, such an esteemed anchor person and an interviewer, and you've always been well-respected in this regard. And as far as AAPI is concerned, AAPI, like Dr. Mehrra said, is one of the largest, the largest ethnic medical organization, representing at least 100,000+ physicians of Indian origin, both the first generation and the native born. And we've been around for 40 years, and so it has been a premier organization, very honorably led by many leaders in the past 40 years, on whose hard work and love of labor we are here today as a esteemed and prestigious organization representing the values of our profession, as well as advocating for good, healthy system for healthcare for everybody in the system. Thank you.
So Dr. Kolli, tell me, what is your vision? We're all looking for quality healthcare, affordable, accessible healthcare, a more improved patient experience in healthcare. Can AAPI play a significant role in this arena?
Yeah, being a psychiatrist and also having this responsibility as being a physician leader of AAPI, and it's my double duty to help with the systems to improve the outcomes of our patients with equity and quality for everybody. Second thing I want to focus is you're not going to have equity and quality without physician wellness being in place. And we have the well-known triple aim of a healthy population health outcomes improving, decreasing the cost of care, and also having the patient satisfaction as the underpinnings of our healthcare system. But that alone is not going to move us to the goal that we want to see. The fourth part of the goal is quadruple aim of the goal is to improve the physician wellness. Unless the physician, the provider himself, are well taken care of, are well supported by the system, they're not going to be able to deliver the care and the quality and the satisfactory care, economically effective care to all the population. So now the quadruple aim is the key component of our policies and procedures that we go forward.
Yeah, you rightly said, physician burnout is a very big issue right now, especially in the last couple of years with the pandemic. We've seen a whole lot of physician burnout. There's a whole lot of disruptive, volatile health industry as we know it is, but it was also a transformative time, and it creates more opportunities. So when we're looking at inclusion and health equity, when we're looking at serving the underserved and marginalized communities, how would you like to be a strategic partner with the legislators advocating healthcare policies that encompass all these issues that we just talked about and make AAPI grow, especially when we're talking of reframing a new conversation in healthcare?
Yes. Yeah, actually, that's exactly the point. When we're talking about improved outcomes, healthcare equities, physician wellness is a significant component of it. And recently, we have championed the South Asian heart disease, also the equity as well as an educational aspect of healthcare. That's one small part of it. That's an example where AAPI has taken lead and accomplished its goal halfway there. We passed the House part of the bill, and now we're looking at the Senate to pass that. So we want to champion causes like that that bring equity to all aspects. And also similarly, mental health equity also is very important. And the 988 suicide hotline is an important milestone in our healthcare equity, because a lot of times when people need mental health support, and they end up in the wrong place at the wrong time in the wrong hands, and that actually compounds the problem and causes a tragic outcome. So having a specific 988 hotline or helpline is very important to improve access and immediate access, as well as continuous access, and having the resources available to the patient at the time or community at the time of their need. So these are simple but very strategic, important goals and points that we need to continue to have a conversation about. So coming to other aspects, so we need to focus on quality and equity. There no, and also physician wellness is so important for equity. If the physician is not well rested or well preserved, they're not going to be able to perform, and there's a burnout, there's a dropout. The turnover of the physicians costs 4.6 billion apparently for replacement, and physician burnout, emotionally exhausted physician is not going to be most objective physician. There's studies showing that there's an implicit bias by physicians who are burned out. So it causes tragic outcomes, tragic delivery of unequal care. So we have to focus on how to change the system. It's not easy. It's been set in stone for a long time, but we need to really continuously work on improving the organizational system, the availability of wellness practices within the system, as well as individual resiliency as individuals, what we can do to improve ourselves. Like you said, this pandemic transformed a lot of people. One of the prime example is myself. I discovered post-trauma growth, how you become a stronger person after gone through some trauma, some tragedies. So each trauma and each tragedy is a challenge that you can overcome and become a better person. You have a greater appreciation of life. You're more connected to people you love. You have more confidence in your capabilities. You take on more challenges, and you become more spiritual. If all of us discover those elements of us, these traumas can lead us to be a better person in a better society. So that's my goal, is to help people to transform themselves into a better version of themselves.
We talked about the pandemic, which is hopefully behind us, but there's another pandemic that is continuing, and that's on mental health. And a lot has to be addressed. It was there before, but the pandemic only brought it out in sharp focus. You being a psychiatrist and serving as a psychiatric medical director in SPHS, how do we move forward? How do we define a healthy, mentally healthy, and physically healthy community?
Yeah, that's a very good question. To quote some statistics, around the world, there are almost 800,000 people are dying from suicide. And in this country, at least 46,000 people are dying from suicide every year. So at least every 11 minutes, one person is dying of suicide in this country. And every 40 seconds, one person is dying across the globe from suicide. So these are very troubling numbers. And these are troubling statistics. These are all preventable. These are not all preventable. It's not like there's no control of these elements and these aspects of well-being. So again, the stigma is there. It's the unequal access is the problem, and resources are not there. So we need to tackle all this from different angles. There's no one silver bullet, one size fits all. Of course, each country, each system has different resources, different priorities. But without mental health and behavioral health being number one priority, all other outcomes will not be equal. Your physician, a patient who has a deficiency in their mental health, they're not going to follow the medical wellness practices or adherence to the treatment. They're not going to keep up their appointment. So all that efforts we put into other aspects are going to be wasted. It's a leaking faucet. Unless we plug that faucet of mental health access and treatment and make it equal and more prominent, how to provide it, how to make it available, how to avoid the stigma, and then only we can really make changes. And we'll be better society, better economy, and better families, better communities for doing that. So
you talked about stigma, which is there, and especially the South Asian communities feel it even more, never talk about it. And when people say, get over it, it's all in the past, snap out of it, I think that hurts that person even more because he or she's going through so much of trauma and pain inside and suffering. And to just say, get over it, or this is okay, it's not, and that person is never going to go out seeking help. Because so we need more education, more awareness on these issues. Is AAPI bringing that, moving the needle in this direction?
Absolutely. That has been my mission, goal number one from the day one. The day I started my presidency, I started talking to the community, social organization, the various different ethnic groups within the Indian communities about stigma, especially self-imposed stigma in South Asian community. There is a higher rate of psychiatric or mental health difficulties in the second generation immigrants compared to their ancestors coming from other country. So that is because we're a different culture now. We have different expectations. Our children live in two cultures and they have to navigate two different lives, one inside, one outside. So we need to make sure we're addressing their feeling. We cannot invalidate their feelings and emotion, tell them to get over it. We don't tell them somebody to get over their cancer. We don't tell them to get over their heart disease. We support them, we educate them, we help them, we provide them guidance and everything what we can. So mental illness is the same thing. There's no shame in it. And I just came out of another webinar just now. It's okay to be not okay. So there's nothing to be ashamed of it. But unfortunately, we ourselves impose a lot of stigma among ourselves, within our families, within our culture, within our communities. So we need to break that barrier. And a lot of times parents feel it is their failure if the child is seeking mental health, because we have a tendency to be over-inclusive in our parenting. We try to parent them beyond their age of 18, 20, 25 into their 40s. We are their financial advisor, with their laundromat, we're their mental health counselor, we are their spiritual guide. We try to be everything. We cannot be. Let them be who they are. Let them seek help when they need. Let them not be have any shame or feeling like they're bringing shame on our families if they seek help. So we need to make it easy for people to seek help. So that's a very important thing I'm championing and talking about in every community. And people are receiving it well because they know their kids are suffering, especially when they go to college. Right? I mean, I did a talk at the local temple for the graduating class of a high school student. I gave them a talk on transitional brain and how it is affected by lack of the prefrontal cortex hasn't fully developed. So they're very risk-taking. Their other aspects of our brain is fully functional. Their hormones are kicking in. The controlling factors like parents and home are removed. So they're in a peer group where everything goes right. So without the prefrontal cortex executive function fully developed, they're at risk. There's a high risk of depression, substance abuse, suicide between the age group of 15 to 24. So we need to tackle this. We need to address it. We need to be upfront about it. We need to be able to have our children or our family members feel comfortable seeking help. We should not make it any harder for anybody. So it's as it is, it's hard to be living with the mental health, and then it's hiding it is even more very troubling.
There's also there's healthy anxiety. There's also anxiety that continues, so that becomes a problem. What is your take on depression? Is it's just being a chemical imbalance in the brain, or there's something more to it? And can we bring in holistic wellness and non-pharmacological approach, especially when antidepressants anytime may not be effective for that particular person?
Right. Yeah, like any other illness has both the nature and nurture component to it. There is some genetic vulnerabilities, and our life experiences, life traumas, or life failures, or challenges can make you more vulnerable. We also can fall into the trap of learned helplessness that kind of make us pessimistic about outlooks of life. So these are all both the chemical aspect. Every psychiatric illness has a biopsychosocial component. There's a biology part of it. There's a psychological attitude part of it, then the social aspect to it. So biopsychosocial, nowadays they're adding the spiritual element to it. So it's a holistic problem. It's not like one solution is going to fit all. So medications or or chemicals can be helpful, but they're not going to cure you. You need to have the social support because loneliness is very deadly. Like many studies have shown, people who are lonely are at higher risk of morbidity and mortality. They die young at an earlier age. Relationships are protective. We know that. Harvard study has shown that. Every study has shown that relationships are so important for our well-being, longevity, and our recovery from our setbacks. So that relationships are important, and our psychological attitudes of optimism, resilience, gratitude, self-compassion, all those altruism, all these things are very protective of our. It humanizes us. We when we suffer, we don't think we are the only one suffering. It humanizes our suffering. It is universal. Suffering is universal. So it doesn't mean that your pain is less, but you also connect with other people and realize you can get help too. So we have to humanize our suffering and socialize our suffering and relieve our suffering in relationships and use our the science of neurosciences and psychopharmacology. So we need to use our relationships, we need to use our social system. And then spirituality. Spirituality is very helpful. Studies have shown that spiritual well-being is very important. Without spirituality, we don't have a purpose for life, without meaning for life, and you don't feel connected to each other and to the universe in itself. So those are all things that we need to work on.
And there have been clinical trials where we've seen meditation as an adjunct therapy has really helped a lot of people, and they're going through tension, anxiety, depression, even bipolar disorders and all. It really helps, and it's clinically proven. So I think mental health counselors and psychiatrists should really tell their patients and their clients to have some quiet time for themselves and bring themselves back to their circadian rhythm.
Absolutely. The meditation is the new black, they call it, right? So when people used to like do jogging and running like 30, 40 years back, people used to ask them, who is chasing you? Why are you running? So, but now everybody jogs, everybody runs, everybody exercises, everybody walks outside. So same thing is going to happen with meditation. Everybody is going to do meditation for their well-being. And then when they do it, they'll be better off. There are some statistics, 80% of the very successful businessmen or leaders do meditate. So meditation is the hidden treasure that we all can do. It's beyond nobody's capacity to do it. We all can do it. We need to set our minds to do it. Meditation is going to be the next best thing to happen in our wellness practices. It's already there. It has taken its time. It's been there around mindfulness-based stress reduction. John Kabat-Zinn, who went to India, studied Buddhism, and came back and kind of formalized that meditative techniques. Now we have heartfulness meditation, mindfulness meditation, compassion, self-compassion meditation. All these things are very popular, but they're only practiced by a small segment. We need to make it more universal. From the school, from colleges, from medical schools, from doctors, from professionals. We need to make it a regular, like brushing your teeth or walking in the evening with your dog or doing your gardening, whatever, wellness practice, or practicing music, whatever. Meditation is going to be one of those extra things that we can do for all of us.
I couldn't have agreed more with you because I was brought out, brush your teeth, do your yoga and meditation. So it's just like a part of your lifestyle.
Right.
If all of us do that, I think we'll become a very healthy planet.
Yeah, absolutely. It's very contagious, that calmness, that peacefulness, that gratitude, that graciousness that comes out of meditation is very contagious. The next person will notice it and ask you why why are you the way you are. Then you can just tell them, I do meditate and it helps me and helps me to be a better person. You're more patient, more compassionate. You'll be more able to relate with your partner, with your coworker, with your employer, with your patient, with your customer. In a way, your anger and resentment and entitlements are not going to be the leading force for us. It's the gratitude, it's the compassion, it's the generosity. These are the factors that connect all of us.
Absolutely. All these feelings of empathy and kindness and conflict resolution, treating people with respect, that all comes when we take that inner journey. I want to go back to the legislative breakfast that AAPI has started. Is it going to continue, and is it going to create a new level of awareness about what AAPI is doing with healthcare policy with our legislators in Capitol Hill?
Absolutely. We last year, due to the pandemic and due to the restrictions in travel, we kind of innovated our legislative meetings with legislators, congressmen, senators through Latte with Legislators program, where we connected with congressmen, senators, Senator Durbin, and many other congressmen, influential people who came to our webinars and answered questions, listened to our feedback, understood our problems, which some of which they're aware of it, some of which they were not aware of it to the extent they need to. So they're very open to listen to us because we are a very elite group, physicians. I'm not bragging, but we are smart about how we articulate our issues. They're not just meant for our own self gain. We are looking at the big picture, what is good for the communities, what's good for our patients, what's good for our society. So when we give that type of feedback, they value it. So we are a valuable feedback loop for them to listen to. They love coming to us and listening to us. They want, because it's unbiased, pretty much. Sometimes, of course, we have our own biases or our own points of view about medical legal risks and reimbursement risks and visas. Those are important part of practical, pragmatic issues. But when you go beyond that and look at the bigger picture and talk about this, we gain their respect. So we can work on both the practical, pragmatic challenges as well as more policy, more ethical values that we need to propagate.
Absolutely. No community left behind. And tell me more about the initiatives that you have for med students, as well as, let's go to the other side, for our seniors as well. What resources does AAPI provide for the young and the old?
Okay, excellent question. I just completed my 100 days on October 4th, and actually I wrote a report and circulated it in the email today. People were talking about it. Now some of the members are giving me positive feedback, how much I'm trying to accomplish, but there's so much to do and so little time to do it. So it's absolutely a teamwork. Nothing can be done by one person, but everybody has to have kind of goals and visions, and it's a team goal. I'm not prioritizing my needs or my goals as the guiding thing. So, but the bottom line is it's a physician wellness. Bottom line is mental health stigma. We need to combat those. And the other bottom line is equity issues. These are the things we need to champion and focus on. Beyond that, we have a lot of routine things we do: community outreach, education, and supporting young generation, physicians, medical student, residents. And your question about how to connect the younger physicians and the more seasoned physicians is a very important topic, because all these old seasoned physicians are ready to mentor. They have a need to mentor too. One of the wellness thing about is to help other people. When we are helping other people as a mentor, you have a sense of joy and a sense of feeling that nothing can replace that. So it's for our own good if we are helping each other. So, and obviously the young generation have different values, different ideas, different vision. They have a work-life balance is different. And older physicians have a different attitude to work and life. So, but learning from their experiences, learning from younger generation's attitude, we can come up with practices that are best for everybody going forward. It's a moving target. We need to continue to work on learning from each other and moving to a better place for all of us.
So make it like intergenerational so that we both learn from both sides and continue to grow.
Yes, absolutely.
And lastly, Dr. Kolli, where do you see AAPI in the next 5 years?
Yeah, that's a very important question. I think I almost feel like I'm a kind of a bridge between more legacy leadership and next generation of future leadership that is going to be more focused, more impactful, how they communicate, because their communication skills are beyond our abilities to communicate. So their dedication is very palpable. And I learned from my interaction with my younger peers as much as probably they learn. So I want to be the bridge between the past and the future. And I have a lot of hopes and dreams. We have a lot of engagement by the young physician, but we always want more young physicians to be with us. And we want to make it attractive for them to connect with us, to make it less kind of difficult barriers of entry into leadership role. We always encourage young people to take leadership role. We put them in the committees, we put them in our entry leadership positions, and we kind of mentor them, train them, learn from them, encourage them, and so make them feel like it is yours. We're just keeping it alive for you to take on, because our past is not going to the guide. Future is where we live. So that's where they're going to take the lead, and we are going to be there watching and helping them in the background and on the back end. So I have a lot of hope and a lot of faith, because our kids are so talented. So we are so blessed to have such a young generation, the model citizens. Of course, there's no pressure on them. Just we'll make our mistakes, we'll learn from them, but let's not make the same mistakes over and over. If we're going to make mistakes, let's make new mistakes and learn from it. That's my theory and my take on future. Let's do it together. I think they have a lot of ambitious, aspirational goals, and we have more sometimes kind of limited ambition, but they don't have those limits in their mindset. So let's expand our horizon and empower them and be there for them in case they need a safety net.
We all hope it will be health equity, inclusion, quality, affordable, accessible healthcare, and AAPI can play a very meaningful, substantial role in this, in creating new conversations in our healthcare policies in the United States. Well, thank you very much, Dr. Kolli. I'm Dr. Renee Mehrra. Stay healthy, stay positive.
Thank you, and I really appreciate your taking time and giving me this opportunity and forum to bring what's on my mind and crystallize in my own mind what I need to do and what I need to focus. Thank you.
Thank you very much, Dr. Kolli.
Bye.